and welcome to RCI's नवशिखर चैनल। आप सभी का RCI के नवशिखर चैनल में बहुत स्वागत है। We are back again with another topic and another couple of experts with us. The topic for us for the today's conference is teaching strategies for person with mental retardation with ASD, that is autistic spectrum disorder. And to adapt this conversation, we have our experts, Indu Chaswal. She is the Director Education in or Action for Autism, and Hema Gauri. She is the Special Educator freelancer. For our viewers, I would like to inform that regarding any of their queries or if they want to share any information with us, they can contact us at our toll-free number 1800-112008. Our phone number is 265-11613 and our fax number is 265-11609. Getting back to our conference for today, as the topic says, teaching strategies. That means teaching methods, or the methods in which the teaching or the process of conducting the lessons should be taken place for a person with mental retardation and a person who has mental retardation as well as ASD, that is autistic spectrum disorder. I would ask ma'am to continue with the conversation. Ma'am, first of all, I would like to ask you, what is a basic difference between a mental retardation and autism?
Yeah, we will come to the slide also. But the basic difference between mental retardation and autism is the unevenness in the skill profile of the individual. Like when a person has only mental retardation, so what happens is that you find a kind of an even delay or difficulty in all the skill areas. So अगर कोई 10 साल का बच्चा है और उसको मेंटल रिटार्डेशन है और उसकी जो मेंटल एज है वो 5 years की है, तो all the skill areas would be around say 4.5 या around 5 years. थोड़ा इधर उधर हो सकता है. But if a child has autism, then this unevenness is very, very prominent. कि आप देखेंगे कि किसी किसी चीज में बच्चा एज अप्रोप्रिएट दिख रहा है. इन सर्टन थिंग्स ही इज इवन बियॉन्ड हिज एज लेवल इन सर्टन एरियाज, एंड ऑफ कोर्स in communication, socialization, he's much below his age. So this unevenness in skills is known as the hallmark of autism spectrum disorders. And the other thing is that let's talk about children with mental retardation who are moderate or mildly affected. They would make bonds with people and a very spontaneous, बहुत natural तरीके से दूसरे से वो एक bond बनाते हैं, whereas very able children with autism also have difficulty in that.
Actually, as she is telling, it's a real fact. If you take MR, it is a single condition with the 3 factors. IQ is less than 70, then they have impairment in the adaptive area, then it's up to age 18. But autism spectrum disorder is a big umbrella. It covers autism disorder, Asperger's, Rett syndrome, childhood disintegrative disorder, PDD not otherwise specified. The whole lot of a thing we label as autism. The labeling itself, it gives confuses. Autism means maybe the child comes under Rett syndrome also. It's a big umbrella issue, ma'am, normally.
Yeah, and the thing is that this, like Gauri ma'am says, absolutely there are a number of disorders under the autistic spectrum, and again they're heterogeneous by nature. They're all very different from each other, but yet they come in a single umbrella because of social communication difficulties and a lot of repetitive behaviors. So not going into details of each and every disorder, just calling them the ASD, we'll move forward with the presentation.
Okay, so just as a summary, we can say that there are no specific characteristics for mental retardation as such, because they have different kinds of
Ma'am, only thing we focus on the IQ, adaptive impairment and age. Okay, characteristic will we give according to a child with MR will having this characteristic, the whole. But in autism, it is heterogenic, different issues comes.
So for our viewers, we can say mental retardation and autism are not the same thing.
Definitely
not the same.
Diagnosis is
but they can coexist. The two coexist, yeah. Okay. All right. So, like you just mentioned, what is autism? We are using the word autism for ASD. Autism is a developmental disorder that is characterized by impaired development in communication, social interaction, and behavior. This is something we just talked about. That these are the three areas which are essentially affected in autism. There'll be a whole lot of other features that people with autism have, but if we follow the diagnostic criteria, these are the three areas in which they will all have the difficulties. Now, the range of these difficulties varies from severely impaired individuals with autism to other individuals who have abnormalities of social interaction but normal intelligence. So here we are saying that as it is, we've called it a spectrum. Spectrum क्या है कि इंद्रधनुष की तरह है. So because it is a spectrum, obviously we will find a range of features over here, but a range of difficulties over here, a range of abilities over here. What happens on one end of the spectrum, we have individuals who have severe problems, a lot of learning difficulties, and they're totally lost in their own world. And on the other hand, we may have individuals who are very able cognitively, they are as able as anybody else, but still they have autism because of the three areas of impairment: social, communication, and repetitive behaviors that you see. Many people with autism do have normal intelligence. Now, difference between ASD and MR, we've already talked about. An uneven skill profile is the hallmark of ASD. Intellectual level may or may not be at the chronological age level, while persons with MR have good or fairly good joint attention. Those with ASD have difficulties in this area. They do not spontaneously share information, enjoyment, and achievement with others. So we have earlier talked about these difficulties in autism, एंड इसको हम थोड़ा सा और ज़्यादा समझेंगे. तो हो सकता है कि जिस व्यक्ति को ऑटिज़म है उसका इंटेलिजेंस लेवल एक आम उसकी एज के व्यक्ति की तरह ही हो, बट एट द सेम टाइम इट कैन ऑल्सो बी लाइक कि इट्स लेस. द अदर थिंग इज दैट मोस्ट पीपल विद ऑटिज्म, लेट्स टेक अ वेरी स्मॉल चाइल्ड, 1.5 साल का बच्चा है, 2 साल का बच्चा है या उससे भी कम. तो ये बच्चे क्या है कि अगर कोई बहुत इंटरेस्टिंग चीज़ देखते हैं या खुश होते हैं तो ये अकेले खुश नहीं होंगे. ये क्या करेंगे कि अगर इन्होंने देखा कि घर के सामने से कोई एलिफेंट जा रहा है तो वो खुश होंगे, लेकिन क्या करेगा एक आम बच्चा और इवन अ चाइल्ड विद मेंटल रिटार्डेशन, वो अपने किसी ब्रदर का हाथ लगा के दिखाएगा, वो देखो. अगर बच्चा मार्केट जा रहा है और उसको कोई चीज़ चाहिए, एक बलून वाला गया, तो द चाइल्ड माइट जस्ट टच द मदर एंड देन से कि आई वांट द बलून एंड लुक एट हर. दिस इज जॉइंट अटेंशन. अगर 2 या 3 लोग किसी टॉपिक के बारे में बात कर रहे हैं जो ये मेंटली रिटार्डेड बच्चा समझ सकता है, तो वो स्पॉन्टेनियस कमेंट शायद बीच में उसके बारे में कुछ दे दे. तो ये जो जॉइंट अटेंशन होती है, जिसको हम बोलते हैं कि सबके साथ मिल के किसी एक अपनी इंटरेस्ट को शेयर करना, कोई कमेंट दे पाना, किसी ग्रुप डिस्कशन का, किसी भी बातचीत का एक हिस्सा बन पाना, दैट इज़ रियली रियली impaired in autism. And sometimes very able, very high functioning people with ASD also have this difficulty, although they have a lot of language, still they would have the difficulty. It is like, just to give an example, we interacted with some students who were doing DSC ASD, and these trainees, इनका पहला encounter with disability was autism. They had never seen any children with mental retardation. So when they went on a field trip and they went on organizational visits and उन्होंने CP बच्चे देखे, उन्होंने mentally retarded बच्चे देखे, they came back and they said, "Ma'am, now we know the difference between mental retardation and autism, because those kids were interactive. They were passing comments, giving us compliments, hello दीदी कर रहे थे. और ऑटिस्टिक बच्चे हैं हमारे, वो इतना कुछ कर सकते हैं लेकिन ये नहीं कर पाते.
Very much
because already autism main thing diagnosis we label impairment in socialization. Continue, no connection between the IQ and the social
Yes.
impairment. It will be there, impairment in the socialization will be there.
तो मतलब बहुत ज़्यादा वो अपनी लाइफ को एक आइसोलेटेड बना देते हैं. दे डोंट जनरलाइज देमसेल्फ. into the social atmosphere, into
That
the
is the
society.
characteristic features.
या और इवन अगर वो अपने आप को, जैसे आगे की स्लाइड्स में हम देखेंगे, अगर कोशिश करते भी है सोशलाइज करने की, उनका मन भी करता है, तो वो क्या है कि हाँ, तो वो उनको सही तरीके नहीं आते करने के, वो बड़े अटपटे ढंग से करेंगे. दे विल डू इट इन अ वेरी अनयूजुअल मैनर. सो दे मे वांट सोशल इंटरैक्शंस बट दे डू नॉट नो हाउ टू इनिशिएट देम इन अ मीनिंगफुल, इन एन अप्रोप्रिएट मैनर, एंड हाउ टू सस्टेन देम like we all can do. So that difficulty remains. So all of them may not be isolated. Some of them may be active socially, but we call them active but very odd people. Okay. So again, do all persons with ASD have intellectual impairment? Now, mental retardation isn't a mandatory feature of autism, but probably about 20 to 30% of autistic children score in the mentally retarded IQ 70 or lower range on IQ tests. So जैसे कि हमने पहले बोला है कि ऐसा ज़रूरी नहीं है कि all children with या all persons with ASD have an intellectual impairment. May or may not. Now, but the thing ki how many of them have, and do they have or do they not have, is a very, very difficult question to answer. And highly expert people who understand both the conditions well, they can find it out better. Because क्या होगा कि a child with autism may not be able to perform on an IQ, on the conventional IQ test formats very well if he doesn't know the tester, the person who's administering the test. If the situation is new for him, तो आप बच्चे को क्लिनिकल सेटअप में ले जाते हैं IQ करवाने के लिए. बच्चे को ऑटिज्म है, वो नए लोगों से मिल रहा है, एक नई सिचुएशन में है,
the child will
परफॉर्म नहीं कर पाएगा,
automatically IQ
स्कोर नहीं हो पाएगा. इसीलिए इस चीज को मेंटल रिटार्डेशन एंड ऑटिज्म टुगेदर के साथ डील करने के लिए काफी हद तक जरूरी है कि जो प्रोफेशनल्स भी हैं वो दोनों कंडीशंस को अच्छी तरह समझते हो.
Even reports are coming when we are taking IQ test. If the child with the Asperger's, their IQ scores in verbal and performance will be equal. But when we take autism condition, IQ scores in verbal goes lower, but performance goes higher. Even
Yes.
it won't, both of the things for the same child, we have to do 2 standardization tests. But for a child with autism, verbal score and performance scores, always there will be a difference. Always performance goes higher. It gives more IQ point comparing to verbal.
और विजुअल परफॉर्मेंस टास्क्स में दे माइट डू वेरी वेल. यू गिव देम पजल्स, ब्लॉक्स, वो बहुत अच्छे कर लेंगे. और जहाँ पे आप कम्युनिकेशन या कुछ उनको कमांड देते हैं, यू विल फाइंड की डिफिकल्टीज आर कमिंग अप, यू नो. All right. Now, what is the incidence of this association, ASD and MR? I think ये गौरी मैम भी इसके बारे में थोड़ा बात करेंगे. और basically studies on the patterns of intellectual deficits have given different estimates. Earlier estimates of mental retardation in association with autism was 75 to 80% of individuals. This is now rejected. The most recent UK study reported associated mental retardation in only 26% of children with ASD. तो ये again it's a very difficult thing to say, क्योंकि पहले माना जाता था that most of the people who have ASD have mental retardation also. But like this, some reports and some studies जो recent हैं with more understanding of ASD, their results are different. They say anything between 20 and 30% people with ASD can have associated mental retardation.
Ma'am, actually before ASD is differentiated from schizophrenia, it is in the autism as an associated condition of schizophrenia, okay? And definitely it is labeled as 7 idiots. The labeling is 7 means certain area they show very good splinter high level skills, certain area that performance, even the IQ may be moderate or severe also, but again they show certain area because as Induma is conveying, it is unevenness. That is why their labeling was 7 idiots. Now it has changed, it is a splinter skills they show.
Yeah.
The wording has changed.
And what happened is that they were known as 7th idiots, which means like exceptionally intelligent idiots. So what happened is, and some of the reports said that certain scientists probably had ADHD or autism or dyslexia.
Even Einstein, we are labeling is a person with ASD. Definitely. Even SATPET, when we take again dyslexia, they are telling Einstein is having dyslexia. Both we are stretching on both sides.
So what happens is that one of the things that we need to remember is that there are these exceptional skills in people with ASD, and but the savants, the Einstein type, they are only 10%. So sometimes when people read all this over the internet, and when parents have got a new diagnosis of the child, they really do not understand what is coming for them. They just feel that we have got exceptionally intelligent children, and they are going to later on excel in life, and they don't understand that if a person lacks social communication, he may not be able to perform, he may not be able to use what he knows.
Progress gets
Yes.
limited.
Because
Even
no
apart
matter-
from it, I think hyperlexic also associates with
Yes.
autism, and they can read anything, but usage, sorry, absent. Again, the parents always, as Indu ma'am is telling, always they are focusing, no, my child is able to read this much, but when he reads, he can't go and do the job. Even if I am writing class or any word, he may point anything, but if I am showing and asking the child to go and get it, absent.
they just
Hyperlexic definitely comes in associated with the autism.
many children with but it's reading without meaning, so it doesn't help them. Now again, mental retardation with autistic features. However, there are individuals who have mental retardation with associated features of autism but do not satisfy the criteria of ASD, because these features may be due to severity of retardation. Very often what happens is that when a child is severely mentally retarded, so obviously all areas are affected, social communication, everything is affected, and they also have a lot of repetitive behaviors. And it is sometimes just misdiagnosed as typical autism, but it is not.
Yes, really, it's an important point. The severe children with any disability, even visually handicapped also, the stereotypic movements comes for the child, just to engage with themselves. But that time they are misdiagnosed as a child with autism.
And you know why it is important to know all this? Because today we are going to be talking about the teaching strategies. So if we have a child who's severely mentally retarded and he gets a diagnosis of autism, then if the educator doesn't understand it very well, we'll make a different kind of program which is only specific to autism and is at a certain probably higher level. Whereas a person who understands that this is a purely mentally retarded child with some features which are like autism, then he will make the program according to that. Sometimes when we don't understand these associations or these differences, we tend to make inappropriate educational programs for children.
So ma'am, like in a case if we have a child, he's showing symptoms of, or we can say characteristics of mental retardation also and autism also. So how will we come to a conclusion whether the child is autistic or whether the child is mentally retarded? How do we come to
I think it is
Psychological report, first we will check.
You will check. You
Special
will come
educator
to
won't
know.
decide anything, ma'am.
And there are diagnostic criteria. The
Yeah.
DSM-4 is used, which will tell you what the condition is. Because the criteria for autism, for example, at the end it says that the child has these difficulties but does not fit into something else. So if you feel
Differential diagnosis
Yes.
comes.
So the experts do the differential diagnosis.
Ma'am, but it's a really an important question, I think so, because a person to label as a mentally, retarded differs. Autism, again, the diagnosis will tell. When you are taking multiple disability, it is easy to convey a child MR with ASD. Again, a question comes, which is the primary disability?
Yes.
The secondary is the associated condition. Always there is a question whether autism is a primary disability or secondary, how to label it. There we are depending totally on the psychological test reports. They have to give us the answer whether autism is secondary or primary.
Absolutely. And a lot of times, one also sees, if you feel that there is severe mental retardation and autism, then even one wants to see what has been the developmental, like the motor milestones development of the
Or
kid.
autism normal?
Yeah, mostly it's normal
Mostly
for
it's
autism.
normal.
Mostly it's normal. So that also gives an indication of whether there is mental retardation. All right. The next we come to, we've been saying that autism is a spectrum and low functioning and high functioning. It's really become very fashionable to use these words. So a range of autistic features across the spectrum. Higher functioning persons with ASD are like Rizwan Khan of the Bollywood film My Name is Khan. That was Shah Rukh Khan. These individuals may have normal or above normal intelligence. They have no significant clinical delay in the early years of life, and there's another term used for many of these, which is Asperger's syndrome. My Name is Khan has become very popular, and it's great that there's more awareness about the autism spectrum through this Bollywood film. And people who are more high functioning are a lot like the character shown in the film, that was Shah Rukh Khan. Although the intelligence was not highlighted a lot over there, but certain features were shown. He was fairly independent, and one would even say that he was fairly disabled. That is autism. Like a person who could move on his own, who could travel on his own, who could manage himself on his own, had such a lot of impairments with sounds and with all kinds of things, with interactions. So those are high functioning people with autism. Now these people with autism, the higher functioning, difficulties arise in social and communication deficits with time. The word time is missing here. Difficulties arise in social and communication deficits with time. There are autistic people with IQs who, however, do not have the other skills necessary to live independently. They cannot follow unwritten social rules. So what happens is that these higher functioning people with autism, they have got okay IQs, but at the same time skills which are needed to live totally independent, to manage yourself, to organize yourself, to plan your time, to plan your work, those are like impaired.
Ma'am, this is an important point. When you take the mental retardation separately, not with associated, mildly retarded, maximum certain people are able to manage independently their life, definitely. IQ is around 68, 69. But when we compare the same child with autism, even the IQ goes up, independency.
Ma'am, so in this case, can we say that it also depends on the amount of exposure given to the...
Not really, because this planning and organization is really affected in autism, and it is the part of the brain. I think it's at the prefrontal lobe.
Yeah.
So it's a part. Our brain works on planning and organization, and the part of the brain which works on organization skills, it is
that executive function deficit will be there.
It's known as executive function.
Like, so in case of a child being diagnosed as autistic, higher functioning one, and it was diagnosed at a very early age, and at that very early age the training and everything was started, so it does not affect utna hi, the effect will remains.
Only thing with the training, we can make you to excel where you are having the talent, but whatever that ma'am has already conveyed, unevenness will continue. Certain area you will excel, certain area the disability, like one of the child is having a good IQ and he has passed with plus 10th and plus 2 all 90 marks, but till he is having sensory problem and he can't brush on his own, and it's not possible for us to make him to independently he can brush himself.
Yeah, and the other thing is, like the last point in this slide says that they cannot follow, or they have difficulty in following unwritten social rules. So we just think of social rules as sitting with a person, talking to a person, interacting.
Initiation won't be there.
Yeah, and as a person grows up, social skills are really difficult, because understanding emotions, manipulating another person, understanding intentions of another person, figuring out what this person, my boss, is going to like and what he's not going to like.
Understanding the tone, modulation, facial expression, body language, it's tough.
So if you have good IQs, you've learnt a lot of things, but you don't have these skills, without interpersonal skills, we really cannot succeed in life. And all of us know that in this world there are people who may not be as intelligent as others. Maybe someone who's always been a mediocre student, but in life has been able to do much better because of interpersonal skills. And here we are talking about people who are high functioning, who may be savants, they may be having IQ levels even beyond 100, but because of lack of interpersonal skills, they are not able to do well in life. So now low functioning. Again, all these terminologies are very confusing, but we'll go back to the previous slide. this one. There are two pictures on this. On the left, there's a picture of this lady, Temple Grandin.
She's an important person.
Yes, she's very important in the field of autism. She's written books, she's delivered lectures, and she is a designer of cattle handling industry. And she's studied, but she says, people call me high functioning, but I'm very, very autistic. So you can imagine she has a lot of sensory difficulties in wearing clothes, in
And
dealing
even
with
she has written
sounds.
how the visual thinking, what is meant by, she explained very well. What is meant by visual thinking that goes in her mind. She simply tells, if somebody tells me church, immediately in my mind, what are the churches I have seen, it will keep on go. And when it correlates with it, I responded. But that time when I read, I couldn't understand. Casually, incidentally, accidentally, it occurred. One of our colleagues' daughter, she is a child with autism. They came to our school, and the ma'am introduced one of her son and me also. She said it is Danny. She simply listened. She looked that side. She literally uttered, she is a verbal child. Third Danny. I was wondering what is third Danny. Then again my turn came. She said she is Gauri. She again looked, said second Gauri. Her granny's name is Gauri. And again one more Gauri, she is listening. Okay. When I read in Temple Grandin, I couldn't understand. One thing, the child already learned, child, she knows first and second. See. And she's a verbal child, so I can understand what is going in the mind of the child, because she conveyed second Gauri. If it is a non-verbal child, and again the child haven't learned first and second means, how come I know what is going on in the mind of the child? But Temple Grandin is a good option that Indu ma'am is showing the picture. She has literally nicely given so many examples of visual thinking.
She, like, she's studied, she's designing machines and everything, but she says that I am very autistic, although I'm known. And on the right, you see the picture of one gentleman in between three ladies, and he's from Pakistan. Very, very able young person. He's kind of, one of the leading people there in multimedia, and he has Asperger's. He's a self-advocate, and he also talks about his difficulties a lot. These are some high-functioning people.
So till now we were discussing about autism and mental retardation, autism, people with autism and mental retardation. We discussed what is autism, then the difference between mental retardation and autism. Then we discussed the incidence level. The recent study says that there are 26% of people with mental retardation and ASD. Then we had discussed about higher functioning person with ASD. These are people who might have normal or above normal intelligence, but they are not so much socially fitted. They cannot follow the unwritten social rules. We'll continue our discussion after a short break.
किसी की मुस्कुराहटों पे हो निसार, किसी का दर्द मिल सके तो ले उधार, किसी के वास्ते हो तेरे दिल में प्यार, जीना इसी का नाम है, जीना इसी का नाम है। मान अपनी जेब से फकीर हैं, फिर भी यारों दिल के हम अमीर हैं। मिटे जो प्यार के लिए वो जिंदगी, जले बहार के लिए वो जिंदगी, किसी को हो ना हो हमें तो एतबार, जीना इसी का नाम है, जीना इसी का नाम है।
हम होंगे कामयाब, हम होंगे कामयाब, हम होंगे कामयाब एक दिन। ओ मन में है विश्वास, पूरा है विश्वास, हम होंगे कामयाब एक दिन। We shall overcome, we shall overcome, we shall overcome someday. Oh, deep in my heart, I do believe that we shall overcome someday. We shall overcome someday. We shall overcome someday.
This is Aparna. She loves chess and Shah Rukh Khan. Her best friend is Swati. She also has visual impairment.
La 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 la
This is Neeraj.
la la हवा धीरे धीरे चल रही
He plays many instruments.
सुनो जो कहानी
He
कह
loves
रही
Mohammad Rafi
है,
and cricket.
ये कहानी सदियों पुरानी है, ये कहानी हमें सुना
He also uses crutches for mobility.
धीरे धीरे
चंदा है तू मेरा सूरज है तू
This is Raj Bala.
मेरी आँखों का तारा है तू जीती हूँ मैं बस तुझे देख कर
With her husband and daughter. She loves cooking and watching TV.
सूरज है तू हाँ मेरी आँखों का तारा है तू
She also has cerebral palsy. Look beyond the disability. Look at the person.
Welcome back after the break. Before going on to the break, we were discussing about the higher functioning in ASD. Now we'll continue our discussion. I would like to ask Gauri ma'am, what are the characteristics of person with mental retardation and ASD?
Actually, if you take a child with MR, it is no compulsory all should have any physical difference. Certain child may have like a syndrome, we can label feature difference maybe, or again microcephaly, macro, that head circumferences. Otherwise, they also look so-called normal, without any other associated physical, okay, maximum. Okay, the same thing in autism also. Okay, but if you take by looking at a child, how come we can understand the child is having not only MR, again autism also means when normally when the parents identify a child as an MR, it takes time, because in case if the child don't have any facial difference, automatically up to age normal, when he goes to school, they will catch he is slow in learning, he is not picking up, okay, change the school or whatever it is, then they will go for the IQ testing. Okay, but if you take autism, definitely within 3 years, what even at the age of second itself, they have all this social discrepancy, language, communication, they may speak. If you take Rett syndrome, the child may be normal, again regression of the motor activity will start. As per just language will be normal, so called, to certain extent, but autism means they won't start pointing, even if we are telling by the child may say like this. That socialization difference automatically gives an idea that the child
Pretend play is
pretend
very
play is
limited.
absent. Automatically, without any assessment report, there is a doubt comes the child is having autism. Okay, then characteristic features of autism comes out first, because the learning gets, if you think about mental retardation, normally impairment in the adaptive area up to age 3, any child's delay means parents won't get that much tense. If the child is non-verbal, definitely they will be going to a speech therapist. Let us give training to the child, okay? But gradually, if the child is very well known with the Down syndrome means okay, it's clearly confirmed. Then what is a child? How come we identify? Because normally a child is having autism means why parents don't need to go for IQ testing? Already labeling is there, autism. What is the necessity go for an IQ test? Normally they don't want to add one more name of disability along with it. Already one labeling is there. So certain time maximum even ask Hindu ma'am, maximum the children in the any autism center parents won't do IQ testing.
Yeah, they don't.
Normally
They don't go because
they won't go.
Because they believe that let's get a functional assessment done, let's see what the current level of performance is, and based on this let us have a program, and let's see what the child is ready to do and ready to learn.
See, when a child identified before age 3 with a characteristic feature, automatically they are moving towards the school with autism. But when a child is identified as a child with the MR, again there's characteristic features like stereo repetitive movements, because socialization also not this thing. If you take mental retardation, again language impairment will be there, but not as equal to ASD. Again, then the repetitive behavior, again we get confused because it may be stereotypic repetitive movement is one of the comorbid condition. OCD, what we label as obsessive compulsive disorder, that also may be an associative factor that may look like the repetitive behavior of autism. Again, we believe on the psychological report whether the associated condition what they identify, is it autism or repetitive stereotypic disorder or obsessive compulsive disorder. Okay, that much. Now I think that immediately it takes time for a child we have to identify, because again in autism if they use CARS, childhood autism rating scale, again they categorize mild, moderate, severe. Then again there is a question whether the child is mild, moderate in the sense in what way the IQ has connection, characteristic features, differences and all. Before that I think let us see the overall the characteristic of a child with MR and ASD as an associated issue. Let us move on to the screen. Characteristics of persons with MR and ASD as comorbid condition. Problems in gathering sufficient information from the environment to learn, unable to make sufficient use of the environment to function, problems in retaining information in short and long-term memory, particular difficulty in separating relevant cues from irrelevant aspects, difficulty in processing information and their abilities to organize problem-solving responses to a situation. Next slide. There is interference in the basic abilities of early communications, which includes making eye contacts and attending tone interpreting, facial expression and body gestures, have acquired splinter skills, they have trouble in abstract thinking, they need to learn small steps with a lot of patience, unable to understand the needs and intentions during interactions. Each child has their own temperament and own set of experiences. They need well-structured environment and information to understand the receiving information. If you take overall, a child with autism, normally if you ask the learning skill, their memory is unforgettable. If they learn anything, it is very difficult for us to change or modify the activity to new step. But if you take a child with MR, their memory retaining is difficult. They will forget and it takes more time. But when the both comes as an associated condition, because see ma'am, MR always it gives problem because of the IQ. Maybe with the IQ we can't tell what is mild or moderate. In no way we can tell the child how much he can cope up. Educationally we are telling educable, trainable, because educable means up to how much he can read, up to even 4th grade or 3rd grade, that much. But you take autism, the characteristic tells certain area they will have splinter skills. That even as what we see in the classroom, a child with only MR, say for example, if he has problem in learning number, definitely the child shows problem in learning time concept, even reading, whatever it is. But if the child with autism and MR comes, definitely we get confused. Certain area, even in numbers, he may do point any answers or write up to multiplication. It goes beyond his level, age.
Ma'am, like in this case, when ma'am was talking about the higher functioning with ASD case, there we take that they're not able to follow the unwritten rules.
No, higher functioning differs. What I am here telling, even the child IQ goes less than 70, definitely they show the splinter skills, that 70. They show even hyperlexia. Say for example, I have seen one child, his IQ is around 37. Okay? And again in the course also it has written severe, whatever it is, forget about this, is psychological reports. As I am teaching him, any spelling in the reading, anything, any word, just show him one time. He definitely will pick up the spelling and he will keep in order.
Yeah, it's like even you will find a child who has hyperlexia reading at the age of 4 or 5, reading English books at the level of 7th and 8th, reading. But the same child, if you say something, if you write something very simple, you say my holidays, I will go to school on the 25th, the next day my holidays will begin. And then you ask him on which date are the holidays beginning, he will not be able to answer, because he will say next day. He will keep on saying next day, because the sentence said, I will be going to school till the 25th, the next day my holidays begin. So he will not say 26, because he's not made any sense of what he's
Even
reading.
they have the pragmatic disability in the communication area.
They don't know what, they don't make complete, they don't have comprehension of what they're reading. And like Gauri talked about math skills.
They are doing excellently, but he won't do the color concept, he haven't learned, even shapes he haven't learned, whatever it is. But even if he learn when the child with autism comes, earlier also I said 7 idiots already we labeled them. So definitely a child, even if his IQ level goes less than 70, definitely they will show the unevenness.
And like she said, they will be able to compute 3-digit numbers, multiply 260 by 890, fat they'll go. But if you give them 10 rupees and send them to the shop and say you have to buy something, this and this, they cannot make a calculation that they bought something for 7 rupees and they will get 3 back, because they have not understood the concept. It's just a computing skill that many of them
not
have.
That concept also. Even certain child, he is doing excellent in maths, addition, subtraction, but money concept is difficult.
Yeah.
Again, there is a confusion. Number in the sense, don't confuse time concept, money concept, addition all together. No, all different parts for the child with autism. Definitely certain area he will excel, definitely. Even certain children with autism, one of the girls, she is very good in drawing anything excellently, but IQ is moderate and severe.
So ma'am, like in this case, like just ma'am told us that whatever, if they don't understand, he will just keep on saying. He did not understand the 26th about it, like the example just ma'am gave.
26, yeah.
So ma'am, can we, is it like whatever they don't understand, they will not repeat it?
I asked him, the next day are my holidays. When are the holidays? He says, the next day are my holidays. He's listening to my question and then finding out a sentence which matches with it. It's a matching sentence. The next day the holidays begin. So it's like he's not read with complete comprehension.
So generally, if you take a child with MR and having autism as a secondary disability, primary will be MR, main topic, because when we are telling about the teaching strategies, here we are thinking about the first factor, disability is MR. Okay, definitely they will have the characteristic features what the autism spectrum is showing. Already, let us move on to the screen. I will simply briefly tell what is the learning limitation for a child with only MR. Okay, let us move on to the screen. Problems in learning by children with mental retardation. Difficulty in understanding abstraction. Poor memory and it takes more time to retain learned items. Difficulty in problem solving and decision making. Difficulty in paying attention. Poor language development, poor understanding of cause and effect, needs repeated instruction, inability to generalize, impulsivity. Ma'am, if you take a child with MR, our major issue is the child whether he is mild or moderate, because in the school setup, generally, let me give an example. When we are teaching a child a concept, normally with a child with autism, within 2 days or even one sitting, they may learn only autism in the sense high functioning, say for example. But when a child with MR comes to teach a number concept to make the child to learn numbers from 1 to 5, sometimes it may take 1 month or again 3 months, or if it takes for the trainable group, it takes even 6 months. Again, after teaching this, when we are moving to the second skill, definitely in the third quarter, if we check at the what he has learned, he has forgotten if it is not used. That we normally every year we in the school setup we are facing the problem in the academic year starting, whatever we are teaching a child only with MR, say for example, definitely as time passes in the end of the year, because every quarter we have to change the activity according to the child, whatever it is, the memory always retaining, it gives problem again according to IQ level also it differs. Okay, but if autism comes an associated condition, we have to remember retaining memory is a major issue with a child with autism. Whatever they learn once, say for example, I'll give a small example. One of a child, he when he was a small child, when his father is going to office, daily his mother conveyed he is going to office, say bye. Going to office, bye. Office, he has daily heard. Okay, when he become verbal, whenever he looks at his father, till now he calls him as a office. But no, it's amazing fact, because the child is with MR also. But if we keep photos, where is your daddy's photo, he will pick up his daddy's photo. And if I ask a question, what is your father's name, he will tell my father's name is C.V. Raman. He tells exactly whatever he learned. But when he looks at his father, he calls him as office till now. Now his age has gone up to even 12. What they learn in one certain situation, it becomes unforgettable for the child with autism. Certain this thing is because when we are teaching a skill concept, if I am doing certain prompting, we have to think in what way the child will do like this. Because, and one more thing, if you take communication, normally here I have conveyed in the learning, the child with MR also having problem in language, but there is a difference in the language impairment with a child with an autism and MR, because they have idiosyncratic, they will tell on their own words. Say for example, if we are giving a word, to add two meaning for a particular word, it is difficult for a child with autism, but not for a child with MR only. Say for example, one of a child in our class, as I was in our early intervention center, I casually said, Shravan, please stand on the line. He was blinking, looking this side, that side, and he was keep on running. And again I am calling, please stand on the line, because we have to take him to the prayer. This is my entrance into special education as a training. I was wondering, because the child, I am taking him as a class in the maths, in the writing, tracing a line. So he learned the word line in the writing skill, that trace the line. I used to tell, hold the pencil, trace on the line. So line means he learned one thing, there will be a pencil, line is a line. That one word he already learned. So what is the meaning, he knows. But when I keep on telling stand on the line, and he is not standing, because one day I was looking at him, the child is looking at the floor. Then I thought, let me check it out. Then I draw a line. I said, walk on the line. Nicely is walking on the line. I thought, okay, I have to think about the language problem of the child. The next day I haven't conveyed him stand on the line. I labeled the one more child. I said, Shravan, please stand behind Ramesh. Stand behind Enos. He nicely standing behind the child and going to the prayer. See, that means when we are teaching a child with autism, I think, ma'am, I will mainly come to the main topic, the categories teaching. That example will helps a lot. Let me move to the screen now.
So what are the basic problems that come?
That I will move to screen. Impact of multiple disabilities. According to De Jong, 1992, population with multiple disabilities represent two categories of needs. Number one, additive impact. Learning can be considered as additive or the sum of the impact of the separate disabilities. Number two, interactive impact. Learning can be considered as interactive. A combination from single disability area would not be adequate Rather, a specific, unique approach must be developed. Ma'am, if you see, what is meant by additive impact in the sense, say for example, a child with mental retardation, okay? Now he is met with an accident, an amputation occurred, now he is not able to walk. But the teaching method, what we are teaching according to the child with MR, it will be the same. What we are adding is, some is how to manage in the wheelchair, okay? But if you take interactive impact, means the child is having autism. That means no just direct method of MR will help us, because again it is having a disability that confuses the child to understand. What I said regarding the child, the line, because he is not only a child with MR, he is a child with autism also an associated factor. That means only the teaching method of MR doesn't suit the child. Again, do we take only the teaching method of autism spectrum disorder in the sense, in the learning problems in MR children I have conveyed, it takes more time for them to learn the small step, and retaining the object in the short term memory and long term memory, it gives them problem. Again, the memory they may forget also, okay, to understand the cause and effect. And even if you take autism spectrum disorder, normally I think we label them as concrete thinkers.
Yes,
Abstracting
absolutely.
is even difficulty with autism spectrum disorder. Again, the child with MR also having problem. That is why normally when we are teaching a child with MR, we always tell move concrete to abstract. Already the child is having problem in the abstract area. Again, autism also adding me, it increases a lot. Then we have to think, when I am talking to the child, we have to think how, because I faced this problem with one of the child. We are teaching number counting, okay? He learned up to number 1 to 10, pointing, even writing, everything gone well, okay? Now we are object, we kept the object here, and I said 1, keeping 1. He was blinking and he is not responding, and I am really telling it is my lucky chance, he is a verbal child. And I am telling Krishna 1, keep 1. He is telling stone, stone. He knows the name of the object. It is stone. I thought, what is this? Then again I kept it away and I have taken bead, and whatever I keep and tell 1, he is telling name of that object. It doesn't this. Okay, then I thought how to tell 1 stone. Let us add. Normally we won't add. It's not this thing. But again I faced a problem. I am keeping 1, 2. He is looking nicely, and when I asked him give 2, what stone he is looking, he is giving that stone as 2. It's not both together.
So he doesn't know what about this is 1.
This is one thing. And one more thing, what I have picked up as 1. I am wondering, the child is searching that same stone to pick up as 1. His memory is that much. By looking at the shape and size of the stones also, and I am facing problem. I thought, let me don't use the different minimum size shape changes. But one more girl, she learned name of the objects like chairs, this, that and all. But when we moved to teaching colors concept, the mother used a chair as orange. Okay, Garima till now, by looking at any chair, she definitely tells chair, but the chair where she learned the color concept, till now name of the object is orange. Till now.
So the first impression is the last impression.
No,
for them.
but the autism children, what they learn, and to add the meaning, it is a difficult.
Pragmatic problem.
It is that, and with the same word taking 2 meaning, again it's a problem. Third thing, if they want, say for example, one of the child, whatever song he listen, he will sing fully. But even if you want water, no chance he will utter water. To teach him in the classroom setup, even with any reinforcement, we are telling water, water. He will listen everything, but if he needs water, he will go and point out what the thing he is doing. But he is singing. The parents are troubling us, ma'am, the child is singing, why can't you teach him to speak, whatever it is. So normally this goes like this. But I think apart from it, one major problem what we face with the child when comes with autism, what is high functioning, low functioning? There is a big confusion among us.
Always.
Let us move on to the screen. Role of cognitive assessments in ASD. Cognitive assessment should be used to supplement behavioral skills and developmental checklists. Autistic children have a wide range of intellectual competencies. The mean IQ of the autistic population is low, but at least 30% have an IQ above 70. Some demonstrate superior splinter skills for a narrow range of abilities. While diagnosis of autism cannot be made based on cognitive functioning alone, individuals with autism do demonstrate a typical pattern of performance deficits on intelligence test. Blackwell 2001. They can provide standardized information about the overall cognitive functioning of a child, the presence of specific deficits, or in a rare cases the presence of superior splinter skills which may go undetected during behavioral observation. And apart from it, I will go to the graph, then we'll overall explain.
Ma'am, before moving on to the next slide, I would just like to ask you this. For any of your queries, you can contact us at our toll-free number 1-800-11-2008. Our phone number is 265-11613 and our fax number is 265-11609. Till now, we were discussing about the different characteristics of a person with mental retardation and ASD. देन हमने बात की थी कि क्या क्या प्रॉब्लम्स आती हैं एक बच्चे को सिखाने में, प्रॉब्लम्स इन लर्निंग बाय चिल्ड्रन विद मेंटल रिटार्डेशन, कि उनको कैसे कैसे वो लर्न करते हैं, कैसे उनको प्रॉब्लम्स आती हैं. फिर हमने देखा था कि अगर एक बच्चे को एक से ज़्यादा मल्टीपल डिसेबिलिटी है तो क्या इम्पैक्ट आता है उस बात के लिए, जिसमें हमने बात की थी एडिटिव इम्पैक्ट की एंड इंटरैक्टिव इम्पैक्ट की. फिर वी मूव्ड ऑन टू द रोल ऑफ कॉग्निटिव असेसमेंट, कैसे कॉग्निटिव असेसमेंट हेल्प करता है एक बच्चे की लाइफ में. वील कंटिन्यू आवर डिस्कशन आफ्टर अ शॉर्ट ब्रेक.
The chief handicap of the blindness is not blindness, but the attitude of seeing people towards them. आइए जानने और समझने की कोशिश करते हैं कि बधिरांधता यानी डेफ ब्लाइंडनेस क्या है. बधिरांधता एक स्थिति है जिसमें दृष्टिहीनता एवं सुनने की शक्ति में कमी आती है तथा जिससे विचारों के आदान प्रदान और रोजमर्रा की आवश्यकताओं की पूर्ति में समस्या उत्पन्न होती है. बलराम एक 9 साल का बधिरांध बच्चा है. वो एक प्री मैच्योर बच्चा है जिसका शारीरिक विकास उसकी आयु के अनुरूप नहीं हुआ था. वो एक निम्न वर्गीय श्रेणी से संबंध रखता है तथा 5 साल से लगातार नेशनल एसोसिएशन फॉर ब्लाइंड दिल्ली के प्रशिक्षण कार्यक्रम से संलग्न है. इन 5 सालों के अंतर्गत उसे रोजमर्रा के कामों में, हलन चलन में उसकी शैक्षणिक जरूरतों के अनुसार संप्रेषण द्वारा प्रशिक्षण दिया गया है जिससे वो इन सब क्रियाओं में स्वावलंबी बन सके. बलराम बिना किसी सहायता के चाकू से फलों को काट सकता है. उनके छिलकों को कूड़ेदान में डाल सकता है. अपने बर्तनों को खुद साफ कर सकता है. उन्हें सही जगह पर रख सकता है. सही बर्तनों का चयन करके खुद खाना खाता है. एवं पानी की बोतल निकालकर पानी भी पीता है. इन सभी क्रियाओं में वो टेक्चुअल साइन लैंग्वेज से निर्देशों को ग्रहण करता है और अपने भावों को व्यक्त करता है। टेलर फ्रेम और ब्रेलर द्वारा गणित, पठन लेखन में भी प्रशिक्षण प्राप्त कर रहा है। सभी बच्चों की तरह उसका भी एक मनपसंद खेल है। उसे सेल फोन को अपने कानों पर लगाकर उसका कंपन महसूस करना अच्छा लगता है। कहा जाता है, वॉकिंग विद अ फ्रेंड इन डार्क इज बेटर देन वॉकिंग अलोन इन लाइट। कहने का तात्पर्य है कि वो लॉन्ग केन ट्रेवल, टैक्टाइल पाथ, ट्रेलिंग और लैंडमार्क्स द्वारा हलन चलन में भी सक्षम है और व्यायाम संबंधी क्रियाएं जैसे ट्रेडमिल, स्टैटिक साइकिल का स्वचालन भी कर सकता है। कहा गया है, द बेस्ट एंड मोस्ट ब्यूटीफुल थिंग्स इन द वर्ल्ड कैन नॉट बी सीन और इवन टच्ड, दे मस्ट बी फेल्ट विद द हार्ट।
Welcome back after the break. Before going on to the break, we were discussing about the different topics. हमने डिस्कस किया था कैरेक्टरिस्टिक्स ऑफ अ पर्सन, एक इंसान के बारे में उसकी क्या क्या कैरेक्टरिस्टिक्स हैं जिसको मेंटल रिटार्डेशन भी है और जो ऑटिस्टिक भी है। फिर हमने बात की थी कि क्या क्या प्रॉब्लम्स आती हैं एक बच्चे को सिखाने में, उसको सीखने में क्या क्या प्रॉब्लम आती है जिस बच्चे को मेंटल रिटार्डेशन भी है एंड वो ऑटिस्टिक भी है। मैम, आई वुड लाइक टू आस्क यू, जब जैसे हमने बात की कि उन्हें बहुत प्रॉब्लम होती है सीखने में, उनकी विजुअल लर्निंग होती है तो एक एज ए टीचर क्या क्या स्टाइल्स और या फिर टेक्निक स्ट्रैटेजीज अपनाते हैं उसको सिखाते हो?
When a person has or a child has autism, definitely learning styles are very different and they're very typical to autism, and we'll move on to the presentation to see that. Learning styles in ASD are very specific. Remember that persons with autism, visual learners, easily distractible, have impulsivity, find difficult in understanding expectations, engaging and disengaging problems, learn better in small groups or one-on-one, difficulty with multiple perspectives, and generalization issues. So when a person has autism, we see that he learns in a slightly different manner, and almost all 99.9% persons with autism are very good visual learners. और ये बहुत एक क्लियर सी चीज़ है कि जब शब्द जो कान में आ रहे हैं उनको समझने में और बोलने में अगर किसी तरह की दिक्कत आ रही है तो ऑब्वियसली अगर कुछ विजुअली अगर कोई चीज़ कन्वे कर रही है, कोई जो चीज़ देखने से समझ में आ रही है, जो इस तरीके से दिखाई जा रही है कि द पर्सन विद ऑटिज्म नोज व्हाट इज बीइंग कम्युनिकेटेड, तो वो कम्युनिकेशन आसान हो जाती है अगर उसको विजुअली प्रेजेंट किया जाए. सो दे आर विजुअल लर्नर्स बिकॉज ऑडिटरी डिफिकल्टीज दे हैव, not only because there is a language and communication deficit, but also because auditory processing is altered. कि when we hear, like अभी मैं बात कर रही हूँ तो जो वर्ड्स निकल रहे हैं, जो साउंड्स निकल रहे हैं इन द फॉर्म ऑफ लैंग्वेज, वो हमारी ब्रेन प्रोसेस करती है उनका मीनिंग. नाउ इन ऑटिज्म दैट प्रोसेसिंग इज स्लो, उसमें इंटरप्शंस होती हैं, तो इसीलिए वो इतने स्ट्रॉन्ग ऑडिटरी लर्नर्स नहीं होते. सुन के सीखना उनके लिए थोड़ा मुश्किल होता है, लेकिन अगर उसके साथ में विजुअल सपोर्ट होगी तो वो ज़्यादा बेहतर सीख सकते हैं. The other thing is that because of sensory issues, ये बहुत easily distract हो जाते हैं. So you know, a small sound somewhere, or a small hole in the wall, or you know, something like something out of the window, or the teacher wearing a beautiful sari with flowers, that can distract the child. Some kind of a smell जो हमें नहीं आ रही वो उनको आ सकती है, that can distract the child. तो ये सारी चीज़ें लर्निंग के टाइम में बच्चे की लर्निंग के रास्ते में आती हैं और उन्हें याद रखना पड़ता
Ma'am,
है.
even if you take a child with MR, distractibility will be there, but it is not connected with the sensory issue.
Yes.
But if you take a child with autism, distraction means because of the sensory hypo, this thing make the child to focus on it fully. It distracts fully and it keep on looks at the flower. Say for example, ma'am is telling flower, the saree doesn't mean he will forget what she is telling or other thing. Fully the child is focusing on the flower pattern.
Yeah. They look at very
That's
small,
because of the
small.
sensory issues problem.
या लाइक मैम जब सेंसरी इशू प्रॉब्लम होते हैं वो विजुअली इतने ज़्यादा किसी चीज़ से अट्रैक्ट हो जाते हैं कि वो छोटी छोटी अननेसेसरी अनइम्पॉर्टेंट एस्पेक्ट्स की तरफ ध्यान देने लग जाते हैं और जो एक्चुअल मीनिंग है उस सिचुएशन का, द मैम इज टीचिंग एंड आई हैव टू लिसन टू हर, आई हैव टू अंडरस्टैंड व्हाट शी इज सेइंग, दैट इज नॉट इम्पॉर्टेंट, बट दैट फ्लावर ऑन द साड़ी इज मोर इम्पॉर्टेंट दैन द एंटायर सिचुएशन फॉर हिम.
So ma'am, like ma'am had just given us an example when she was teaching 1, 2, the pebble one that she was explaining. मैम उस केस में जब हमें उस बच्चे का एक परसेप्शन चेंज करवाना है कि 1 ये पेबल है बट दिस इज द नंबर 1, उस केस में हमें क्या क्या प्रॉब्लम्स आती है और कैसे आप
या उसमें यू नो जो कॉन्सेप्ट्स होते हैं लाइक लेट्स आई थिंक और ज़्यादा कॉन्क्रीट वे में हमें समझ में आएगा ये अगर हम एक कलर कॉन्सेप्ट लेते हैं. तो फॉर एग्जांपल कि हम बच्चे को एक रेड कलर का बीड दिखाते हैं, एक मोती दिखाते हैं रेड कलर का एंड वी से दिस इज रेड. नाउ ऑब्वियसली द बीड हैज़ अ शेप, इट इज़ सिंगल एंड इट हैज़ अ सर्टन टेक्सचर एंड वो देखने में कुछ है. सो व्हाट इज द रेडनेस? So the redness of red and the blueness of blue, ये क्या है? ये उनको समझना इतना आसान नहीं होता. When I say red about a certain thing, what am I talking about? For other people, it's very easy to understand that it's something, you know, this visual color thing. Similarly, when she talked about that pebble being introduced for a child with autism, what will happen? He will see the pebble and he might think इसका नाम 1 है. So the label is 1. It's known as 1. Maybe वो shape देख रहा है and he calls it 1. Maybe he feels कि putting something on a table means 1. So we have to be very specific while teaching and there is a methodology that goes with it. We have to break it into steps.
Actually, even how Indumam is connected, visually we showed the child. We showed the number called 1 and 2. He said it is written numerals. In Tamil we convey the child and we showed the bead. We said counting. We drawn a picture. Counting means picking up an object, keeping and telling along with number, and we said it is bead only, but if you want biscuit, then we are taken biscuit. If you want to eat, I am asking you how many biscuit you want. If you tell I can count and give, this is counting. Counting means we will take the object and tell with numbers.
Yeah, and it will be...
We explained that abstract because it is abstractness. Counting word is abstract word.
And for a child with MR, it will be, I think, easier because he'll follow the language. When the teacher is giving a rationale of what is 1. But for a child with autism, the entire process has to be made as visual as possible. So what we would do is, first he has to learn to identify the shape 1. And then, you know, what we could also do is that we have a number of beads. And I take out 1 and I say, look, 1. And then I remove the bead. I have a number of pencils in front of him. I take out 1 and put there 1.
Ma'am, but then the child will start saying 1 to the bead also, to the pencil.
No, that is good.
That's why I'm using different things.
Different thing. If we stick to only one object, he will stick 1 for only that girl. Yes. What I said, orange. The mother has showed the chart. What is the chart means? It is orange. That's all. Finish.
It is like for color red. अगर हम कोई like you know red color का paper ले लें और बच्चे को वो दिखाएं this is red, और हम बच्चे को फिर एक रेड कलर का क्लॉथ ले लें रेड, हम बच्चे को एक लकड़ी दिखाएं रेड कलर की रेड, हम बच्चे को वूल दिखाएं रेड कलर की रेड, हम एक बॉटल में रेड कलर का पानी भर लेंगे रेड, he will at once know what is red because these are things which have different textures, different materials, but one thing is common, the red in them, and he gets what is red. So similarly, when I take out 1 from many every time, sometimes buttons, beads, whatever, and he sees a single unit being taken out and that is called 1, then he gets the meaning of 1.
So I'm like, even in this case, when like ma'am had explained an example when she was introduced to a girl and when she told her the name, she said Gauri 2.
Yeah.
In that case, ma'am, the child won't keep on adding
No,
the
this is
numbers.
a this is a child who knows numbers.
That is visual thinking.
And a child who has a number concept. This child has a number concept already. And again she has the number concept. She is using it in such an inappropriate manner. Just to remember serial, making this is the second Gauri. She may not use it in everyday life to calculate money or see time. But she's using it in such an odd manner.
There's a different level for
which
the teaching.
Yeah. So again, children with the autism, they have a lot of difficulty in engaging and disengaging, which means कि उनका attention किसी एक activity में लेके आना थोड़ा कठिन होता है. क्यों? क्योंकि वो जो कर रहे हैं उससे उनको हटा के दूसरी एक्टिविटी में लाना मुश्किल होता है. बहुत से ऑटिस्टिक बच्चे हैं जिन्हें ADHD का मिसडायग्नोसिस मिल जाता है. और ये याद रखने वाली बात है कि ADHD बच्चा किसी चीज़ में ध्यान नहीं देगा, लेकिन ऑटिस्टिक बच्चा क्या है, वो एक चीज़ में ध्यान दे रहा है और इतना ज़्यादा ध्यान दे रहा है कि उसको उसका ध्यान शिफ्ट करना मुश्किल हो जाता है. सो अगेन टीचिंग के समय इन चीज़ों का भी ध्यान रखना है. तो आई थिंक वी नीड टू मूव ऑन टू द नेक्स्ट स्लाइड सो दैट वी कम टू द एक्चुअल हाउ डू वी टीच देम. सो मैनेजमेंट और टीचिंग इन ऑटिज्म. Management of autism, teaching of autism, educational intervention, behavioral intervention, communication intervention, sensory integration therapy. There are medical interventions, vitamins and nutritional supplements, dietary intervention. So of course, educational intervention में बच्चे को हम concepts वगैरह जो सिखाने हैं, उसके आसपास जो चीज़ें हैं उसके बारे में उसको इस दुनिया का एक हिस्सा बनाना है. तो concepts, एकेडमिक्स, उसके लेवल पे कुछ चीज़ें सिखानी है. बिहेवियरल इंटरवेंशन बहुत ज़रूरी है, बिकॉज जितनी डिफ़िकल्टीज हम देख रहे हैं ऑटिज्म में आती हैं कि सोशल कम्युनिकेशन डिसऑर्डर है. द चाइल्ड डजंट नो हाउ टू कम्युनिकेट. सो इफ़ ही इज़ नॉट कम्युनिकेटिंग इन द अप्रोप्रिएट मैनर, देयर इज़ एवरी चांस कि आने वाले समय में ये बच्चा जो बोल नहीं पा रहा, ये अपने आप को एक्सप्रेस करने के लिए कुछ अजीब से तरीके अपनाएगा. चिल्लाना, खींचना दूसरों को, फ्रस्ट्रेटेड हो जाना. तो जब सोशल और कम्युनिकेशन डेफिसिट्स होते हैं, एक उसका आउटकम इज बिहेवियरल डिफिकल्टीज, एंड ऑटिज्म स्पेक्ट्रम डिसऑर्डर्स आर नोन टू बी बिहेवियरल सिंड्रोम्स. सो बिहेवियरल इंटरवेंशन इज़ अ वेरी इंपॉर्टेंट पार्ट. सेंसरी इंटीग्रेशन थेरेपी भी बहुत ज़रूरी है. अगर हम बच्चे की सेंसेस को पुट टुगेदर नहीं करेंगे, जैसे अभी गौरी मैम ने भी बोला कि डिस्ट्रैक्ट हो जाते हैं, अगर जब हम कुछ उनको पढ़ा रहे हैं, क्योंकि मल्टीपल पर्सपेक्टिव्स में उनको दिक्कत आएगी. मल्टीपल पर्सपेक्टिव क्या है कि मैं फॉर एग्जांपल ये है मेरे पास और मैं बच्चे को बता रही हूँ कि इसको हम बोलते हैं स्पेक्टिकल केस. नाउ क्या है कि आई एम सेइंग इट्स ऑडिटरी, द चाइल्ड इज सीइंग दिस, देयर आर टू एस्पेक्ट्स, और उसको ये सब समझना है. और फिर क्या है, इसके ऊपर और भी डिस्ट्रैक्शंस हैं इस चीज़ के ऊपर. तो ये जो मल्टीपल पर्सपेक्टिव्स होते हैं,
सेंसरी ओवरलोड इज अ प्रॉब्लम,
उनको दिक्कत आती है. तो इसीलिए सेंसरी इंटीग्रेशन थेरेपी से हम काफी हद तक इस चीज को कंट्रोल में ला सकते हैं.
Even actually what Indra is telling, we special educator who are dealing MR with autism, we have to understand when a child is having MR separately, no chance we will face such sensory issues. Then we have to widen our knowledge when the sensory issues comes, how we have to manage the child, because the child may have hypertactile sensitivity, he is not touching gum. Then let me change the modification as I conveyed interactive impact, in the sense now modify it. That means give a brush to the child, letting first learn to paint, glue, and what are the activity I am teaching, because the sensory integration I have to do it separately. I can't confuse the child in such a way that you have to use your finger, and so that we normally won't face when it comes MR separately.
Multiple tasking becomes.
It is.
Sensory overload issue is a major when it comes in the associated issues.
Okay, we'll move on. What are the popular strategies in teaching? These like applied behavior analysis, verbal behavior approach, picture exchange communication system, teach structured teaching, floor time, relationship development intervention, social stories. So these are some of the very well known teaching methods, and today we are going to be talking about the ones which are most useful and which are helpful in every situation. and we will move on to the next.
Yeah, I will add one more thing. We special educator with working with MO children, we have to remember for the teaching method there are hundreds and hundreds separate strategies like ABA teach like only with ASD group. But when we come to MR group, we don't have that much of strategies, different names and techniques. This we are using inclusive of all that together, because when ABA started, they added the child with MR also.
Yeah.
Reports came different.
Even teach now is extending to MR
differs, but
all right, ABA. Let's see what is ABA. Applied behavior analysis. This is a behavior or a psychological technique that is based on the sound principles of behavior modification. Therefore, reinforcement, shaping, chaining, prompting, fading, generalization are applied. Non-aversive punishment procedures like timeout, overcorrection, response cost are also applied. The child learns at the tabletop and then skills are carried to the natural environment. ABA is something which has been developed in the West, and जो ABA typical ABA करते हैं वहाँ पे अमेरिका में और UK में तो काफ़ी rigid pattern से करते हैं कि 1 week में 42 hours of one-on-one work with the child, very heavy.
But scientifically, they have showed improvement in the children.
The studies,
ABA is a statistical report improvement they have shown.
It's a researched program.
Research program.
और basically ये program सिर्फ simple सी बात कहता है कि behavior management, modification के principle को use
Skinner's
करता
method
है.
they use normally.
The operant condition of Skinner. They say that if a behavior, if any response of the child, let's not say behavior, if any response of the child at the time of teaching is followed by a desirable consequence, the child will continue giving the responses. If it is followed by like an unpleasant consequence, the child will stop giving the response. So for example, I tell the child, do this, and बच्चे ने सुना ये इंस्ट्रक्शन और बच्चे ने ऐसा कर दिया, and I say wow, very good, yeah, I give him a chocolate or a toffee or a chips, something like that. तो हुआ क्या कि रिस्पॉन्स था ये और कॉन्सिक्वेंस था डिजायरेबल, विच वॉज द रीइंफोर्समेंट. इट कैन बी सोशल, लाइक आई सेड वाओ वेरी गुड, और टैंजिबल, गिविंग द चाइल्ड समथिंग. सो द नेक्स्ट टाइम आई से डू दिस, he will want to do this because he remembers the reinforcement. So it's a very positive way of teaching the child, and ideally a person who understands ABA, because it's not as simple as I'm saying.
Yeah.
It is
actually
ABA,
ma'am, actually if you take in the ABA, the shaping, whatever it is there, we are same thing we are using a child with MR also.
Yeah.
Only thing ABA are the time rigidity and the same thing we modified and flexibly we changed according to our Indian this thing, and we are moving the same thing as what Indu ma'am is telling: shaping, chaining, prompting, fading, reinforcement, everything, social reward, primary, secondary, all we are using, but we modified.
Yeah. And it's a very good method of teaching, but one must be flexible and not very rigid. The next is very effective in autism. It's TEACH. TEACH is a unit. It is in the University of North Carolina in America, and there they have the TEACH unit, which works on what is known as structured teaching. Basically, let's see what it means. TEACH structure. This refers to visually clear environment in which the child sees and knows what is expected, where, when, how. So हमने पहले बात किया था कि क्योंकि ऑडिटरी लर्नर्स इतने अच्छे ये नहीं है, विजुअली लर्न करते हैं, तो उनके लिए एक ऐसा एनवायरनमेंट क्रिएट किया जाए घर में, स्कूल में, कि उनको देख के ही समझ में आ जाए कि मुझे क्या करना है, कहाँ करना है और कैसे करना है. तो we will understand that very well when we see the visuals. Now here is a visual, and this shows that in one corner of a room there is a place made where the child sits with the teacher for one-on-one work. Teacher sits at a lower level so that she can make an eye contact with the child. There is a basket on the right of the child which very clearly tells the child, finish your work and put it here. Now we don't ऐसी ज़रूरत नहीं है कि हम बहुत बड़े बड़े स्कूल्स में हो कि अलग एरिया के लिए अलग अलग एक्टिविटी के लिए अलग रूम हो या बड़े घरों में रहें. ये जो कॉर्नर नज़र आ रहा है इस स्लाइड में, दिस इज़ जस्ट अ स्मॉल कॉर्नर इन अ classroom which has been created by putting a cupboard. You can see the cupboard there, and it has been created. A cupboard has been placed and a corner has been made. So this is known as the one-on-one work area. The child sees this area and he knows exactly what's going to happen. He goes and sits here, डिस्ट्रैक्शन फ्री, बिकॉज एक कबर्ड लगा दी है, बाहर की बहुत ज़्यादा चीज़ें बच्चे को दिखेंगी नहीं, तो उसको मालूम चल रहा है उसने टीचर के साथ बैठ के या मम्मी के साथ बैठ के यहाँ पे काम करना है. मेरा काम ख़त्म होगा तो कहाँ पे रखना है, उस बास्केट में. बिकॉज वेरी ऑफन द कॉन्सेप्ट ऑफ फिनिश आवर चिल्ड्रन डू नॉट हैव. वो क्या करेंगे, एक वर्कशीट में कुछ ड्राइंग करेंगे, कलरिंग कर दिया उन्होंने एक शेप के अंदर, फिर बैठे बैठे कहीं और कर दिया, फिर कहीं और कर दिया, फिर पेपर फेंक.
Ma'am, even apart from this amazing factor, when we start the activity in the class, when we are written something, definitely if a child only with MR, he will simply take the notebook and write. But amazing factor, if the child is having ASD means he will turn page and check how many pages we have written and we have to finish. The tension there shows. The one advantage in teach is how, where, when, how many times he has to do, how many. We will literally tell you have to do it 5 times. You have to do it 3 times.
And there is a slide which will show how many boxes he has to pack. I'll just show
Ma'am,
that.
but like in this case only, if you're talking about, the environment does not have anything to distract, right?
Yeah.
It's been made a distractfulness for a person, for a child. But in that case, ma'am, generally for children it gets a little boring also.
Not for a child with
ASD.
ASD.
When we plan according.
But this is not going to be his whole day. I will show you another environment which is full of nice things. So when the child finishes his work and maybe after this he has to sit in a group
We
and do
give break
something.
time and all.
Yeah, here is the break time. This is the break area for the child. And again ये उसी रूम का break area है जहाँ पे वो 1-on-1 बनाया था. यहाँ पे भी existing furniture जो है वो use किया है, एक table है, एक छोटी shelf है. This is known as break. तो वो बच्चा अपना 1-on-1 करके आया और अभी उसने अगली एक्टिविटी के लिए जाना है, बॉल ग्रुप में बॉल के साथ खेलना है या एनीथिंग एल्स, बट वो 2-4 मिनट के लिए उसको एक
The transition, what we call normally.
Yeah.
It takes time. We have to give gap. Normally for a child with autism separately means definitely to change from one activity to other activity, please give a time break.
We said
Otherwise,
engaging, disengaging
transition, it is a
problems.
problem for the child to move to the next activity immediately. But if it comes to a child only with MR means no problem. But associated factor autism means definitely we are giving the
Yes.
transition time,
Absolutely.
giving break. We are telling now wait, this is a break time for you. We have to tell break time for you.
And it's a 2 minutes break,
2
3
minutes.
break.
In case as ma'am is showing in the picture, there is no space. I will literally tell you have break time in your chair itself. That's all.
Yeah, and put something, visual.
Whatever
This
he
is what you
prefers,
have to
that
do.
time let him satisfy his sensory issue or whatever. We won't disturb the child that time normally.
So this is a boy who actually likes to jump a lot. So you don't see any toy in his hand, but we also have toys here. So it's not as though the environment is boring. The color of the cupboard is yellow. There's a basket full of toys. But the question was very valid because it was almost like house arrest what you saw. But that is only for the one-on-one section. All right, we go to the next. We see the next area, and here you can see that in the middle of the classroom, 2 tables are put together and the child knows, oh, there are 2 tables together, which means more children will come and sit with me. And there is an activity which you are seeing them doing, and in this activity the child has to do packaging it's known as, in small film cans. And very clearly in this picture you see that on the left hand side of the child there are 1, 2, 3, 4 film cans, and he knows that these are the 4 I have to do. After this my work finishes. He packs them and puts them on the right. So this is visual clarity
Normally
in work.
when we are working with the child with ASD, we have to search the shoe boxes, whatever. Normally we get labeled as this labeling is there. Making the teaching aid.
This is a shoebox activity that is being shown, and in the teach program they train you to make shoebox
boxes, all people.
activities.
We have to.
The next, again, this is the picture of a mother. She's working with a child who was very easily distracted. So you can see how she structured the work area. This is again visual clarity. What do I have to do when? So this is a visual timetable for the child. Very clear. Calendar time. And you can see in between lot of sensory issues have been kept in mind. So before writing, lot of tactile things, sand play. And before computer, the child does computer, needs to attend. So a lot of jumping before that, so he settles down during computer time. This is a visual timetable, so the child visually knows what is going to happen. He follows his timetable.
मैम बिफोर मूविंग ऑन टू द नेक्स्ट थेरेपी, एक छोटी सी समरी कि हमने अभी तक क्या क्या देखा. हम बात कर रहे हैं पॉपुलर स्ट्रैटेजीज, जो स्ट्रैटेजीज हम ज़्यादा से ज़्यादा अप्लाई करते हैं इन बच्चों के साथ, बच्चे जिनको ऑटिज़म है, जो ऑटिस्टिक हैं एंड वो मेंटली रिटार्डेड भी हैं. हमने बात करी अप्लाइड बिहेवियर एनालिसिस की, जिसमें कि हमने देखा कि कैसे एक बच्चे को जो है उसको सिखाया जाता है विद द रीइंफोर्समेंट. अगर जो भी हम चाहते हैं कि बच्चा करे, हमें उसके लिए एक ऐसी चीज़ करनी पड़ेगी जो उसको अच्छी लगेगी. अगर उसको अच्छी लगी तो फिर वो फिर से वही चीज़ करेगा, वही रिस्पॉन्स देगा जो हम चाहते हैं. नहीं तो फिर it might not be occurrence of the behavior might not be there. फिर हम बात कर रहे थे टीच की, TEACCH की, जिसमें कि हमने देखा कि कैसे हमें एक एनवायरनमेंट को मॉडिफाई करना पड़ता है, कैसे एक बच्चे के हिसाब से उसके क्लासरूम का, उसके ब्रेक टाइम का एनवायरनमेंट, वॉल्स, रूम्स, टेबल सब कैसे होने चाहिए, ये सब को हमें ध्यान में रखना पड़ता है, सो दैट जो उसकी डिस्ट्रैक्टेबिलिटी होती है वो कम हो जाए, वो कम डिस्ट्रैक्ट हो और ज़्यादा से ज़्यादा एक कंस्ट्रक्टिव जॉब कर पाए. Till now we were discussing about all this. We'll continue our discussion after a short break.
कोई मुश्किल हो, दूर मंजिल हो, never stops us from dreaming. हारता है वो, हार माने जो, we are what we believe in. हम धरती को अंबर से मिला दे, हम उड़ सकते हैं, उड़कर दिखा दे, हम छू ले सितारों को. We can touch the sky. आशा के पंखों पे we can and we will fly. We can and we will fly.
ऑटिज्म एक व्यापक विकासात्मक विकलांगता है जिसके लक्षण जीवन के प्रथम 3 वर्ष में ही दिखाई पड़ते हैं, जैसे असंगत खेल, असमान स्थूल एवं सूक्ष्म गामक क्रियाएं, शाब्दिक संकेतों पर अभिव्यक्ति न देना,
Where is the cup? देखो, open your eyes, open करो, open करके, open.
नियमित कार्यक्रम परिवर्तन का विरोध करना एवं अवलोकनीय शारीरिक उच्च स्तरीय या निम्न स्तरीय क्रियाकलाप. UNCRPD 2007 सेक्शन 1 ऑफ आर्टिकल 4 निशक्तता के क्षेत्र में कार्यरत प्रोफेशनल के प्रशिक्षण पर महत्व देता है. ऑटिज्म के क्षेत्र में सरकारी एवं गैर सरकारी संस्थाएं कार्यरत हैं जो भारतीय पुनर्वास परिषद द्वारा पंजीकृत हैं. सोसाइटी फॉर एडवांस स्टडी इन रिहैबिलिटेशन एक ऐसी ही गैर सरकारी संस्था है. कनिष्क 13 साल का एक ऑटिस्टिक बच्चा है जो इसी संस्था से प्रशिक्षण प्राप्त कर रहा है. असंगत क्रियाएं, कार्यकलापों में निरस्ता, असमान स्थूल एवं सूक्ष्म गामक क्रियाएं जैसे बॉडी रॉकिंग और फिंगर रिगलिंग उसमें देखी जा सकती है. उसे मैचिंग और पेस्टिंग, पॉइंटिंग जैसी क्रियाएं सिखाई जाती हैं.
Very good. Glass. Where is the glass? Glass. Very good. कप को टच करो जल्दी से. कप को. Where is the cup? Very good. कप में क्या करता है कनिष्क? टी पीता है। चलो ग्लास, वेयर इज द ग्लास? वेरी गुड। चलो बाउल की तरह, बाउल बाउल जल्दी से टच करो बाउल को। वेरी गुड। बाउल में क्या करता है कनिष्क?
तथा साथ ही साथ रोजमर्रा की आवश्यकताएं जैसे खाना, पीना, कपड़े पहनना, और व्यायाम संबंधी प्रशिक्षण दिया जाता है। ऑटिस्टिक बच्चों को भिन्न भिन्न प्रकार की कार्यविधियां उनके स्तर के अनुसार सिखाई जाती हैं। जैसे कुछ बच्चों के लिए कलरिंग विद इन वन एरिया, मैचिंग एंड आइडेंटिफिकेशन, फाइन मोटर स्किल्स, आई हैंड कोऑर्डिनेशन, कंसेप्ट ऑफ वेजिटेबल्स, फ्रूट्स, बॉडी पार्ट्स, कलर्स पर जोर दिया जाता है तथा कुछ को प्रश्न पढ़ के उत्तर देने में और रोजमर्रा की आवश्यकताओं को पूरा करने में सक्षम बनाया जाता है। इसके अलावा राइम्स, डांसिंग, सिंगिंग द्वारा लेजर एंड रिक्रिएशनल एक्टिविटीज में भाग लेने के लिए प्रोत्साहित किया जाता है। इन सभी कार्यकलापों एवं प्रशिक्षण का एकमात्र उद्देश्य उन्हें स्वनिर्भर बनाना है, ताकि ये डगमगाते पांव सक्षम बन जीवन के एक एक पायदान पर दृढ़ता से आगे बढ़ें और अपनी मंजिल को पा लें। एक तारा टिमटिमाता, उसने आकाश को छू लिया। एक लौ जली कहीं, उसने अंधकार को मिटा दिया।
वेलकम बैक आफ्टर द ब्रेक। बिफोर गोइंग ऑन टू द ब्रेक हम बात कर रहे थे मैनेजमेंट की। हमने बात शुरू करी थी टीचिंग की, कैसे डिफरेंट टीचिंग स्ट्रैटेजीज हम लेते हैं एक बच्चे को सिखाने के लिए। हमने शुरू की थी कि क्या क्या डिफरेंट लर्निंग स्टाइल्स होते हैं, जिसमें कि हमने बात की थी एज अ विजुअल लर्नर। जो वो विजुअल लर्नर होते हैं, जो देखते हैं वही सीखते हैं, उसी को वो परसीव करते हैं, उसी को वो याद रखते हैं। फिर हमने बात की थी कि वो एक इजीली डिस्ट्रैक्ट हो जाते हैं, दे आर इजीली डिस्ट्रैक्टेबल। देन वी हैड मूव्ड ऑन टू द नेक्स्ट प्रॉब्लम दे हैव इज दे हैव इम्पल्सिटी। दे आर वेरी इम्पल्सिव, ज़्यादा देर तक रिटेन नहीं कर पाते हैं। देन वी मूव्ड ऑन टू द इंगेजिंग एंड द डिसएंगेजिंग, ये बहुत ईजिली हो जाता है। नेक्स्ट वी मूव्ड ऑन टू द मैनेजमेंट, जिसमें हमने बात की कि मैनेजमेंट किस किस एरिया में उन्हें चाहिए होता है। मैनेजमेंट इन एजुकेशन, in behavior, in communication, social integration, then medical, vitamin and nutrition, and the dietary. Later we moved on to the what are the popular strategies. हम क्या क्या strategies अपनाते हैं, जिसमें हमने देखा था applied behavior analysis and हमने देखा था TEACCH, teach को। अब हम बात करेंगे sensory integration therapy की। मैम, over to you.
सेंसरी इंटीग्रेशन थेरेपी, जैसे हमने पहले भी बोला है, बहुत ज़रूरी है और ये जान लेना बहुत ज़रूरी है कि हम इसको टीचिंग में क्यों इस थेरेपी को लेके आ रहे हैं। बहुत सी चीज़ें हैं टीचिंग से जो कनेक्टेड है, लाइक विजुअल परसेप्शन, रीडिंग कर पाना, दो चीज़ों को मैच कर पाना, एक पेंसिल होल्ड कर पाना एंड टू राइट विद द पेंसिल। सो यू नो, फॉर ऑल दीज थिंग्स सेंसरी इंटीग्रेशन इज नीडेड, and this is a difficulty area in autism. For example, if I have to write with this pen, I have to touch the pen, I have to have a certain kind of a grip on the pen, I have to hold it at an angle and then move it and also see. So many senses, you know, the proprioceptive sense of gripping, holding, tactile, visual, movement, they are all working together. और अक्सर हम लोग राइटिंग को जो सोचते हैं कि राइटिंग है पकड़ के लिखना है, but actually there are so many senses which are integrated, and a good occupational therapist can help a child with autism to do this.
Even we always face problem when a child is having only MR in the while you are teaching writing, the tripod grip or holding, it comes easily. Comparing to a child with autism as associated condition, to hold the pen, even they will hold here, otherwise they will press more, otherwise there will be grip on me, simply that we face when it comes in an associated condition because of the autism is having
Yes,
a
and
sensory.
integrating problems can be so much that we just hold the pen, Gauri. She's a child who cannot hold the pen. She just cannot hold it. But if I give her the grip, then the same child writes very well, because the problem is gripping and
Gripping. But normally when it is only M or maximum, we class teacher won't that much problem. If it comes at an associated with autism, that time that fine motor activity, writing and all, it takes more time.
eye-hand coordination, lot of difficulties. So let's move on to what is sensory integration therapy. Sensory integration therapy. Sensory integration refers to the integration and interpretation of sensory stimulation from the environment by the brain. In very general terms, it means the working of the senses in an integrated manner to perform activities and for learning in everyday life. तो जैसे हमने पहले बोला है कि हमारी कोई भी सेंस अकेले काम नहीं करती. We have to remember that. If I'm walking on the road, it's not just that I'm seeing and I'm walking. It's everything, जो sounds आ रहे हैं side से, they help me in maintaining that walk. अचानक एक हॉर्न की आवाज़ आएगी तो the way I walk will change. Suddenly, I'm walking straight, I'm talking to someone, and suddenly I see कि एक deep आगे जाके एक there is a deep pitch over there और एक गड्ढा है वहाँ पे, तो वो कितना deep है उस पर डिपेंड करेगा वो कितना broad है कि whether I have to jump over it, step over it or walk aside. So my body movements are governed. So at any given time we are human beings. Tomato and apple, round, red, but I hold them and grip them differently because my vision aids my touch.
But coordination of all the senses is a problem with ASD.
Yes.
They are simply even temporal granted. She said on her own, sensory overload I can't tolerate. Together 2 or 3 sensory stimulation to taking together, it creates problem.
And it creates learning problems because
problem.
you have to integrate them to learn.
Because
That
the
is
child,
the problem.
as even ma'am conveyed, the child can't write. But holding problem is there. Because of that issue, we may think the child is not able to write and we may drop also. Or because of the sensitivity, the child won't hold the pencil. Then, how to teach make the child to writing?
So sensory integration is a very important part of teaching. Or these slides show that children may be seekers of movement. They want to, they rock their body, and either they are like hypo. So some of these activities help a lot. Like before writing, I had shown an earlier timetable, a visual timetable in which before writing there was sand play because the fingertips will get more, alert with the sand. Lot of such activities, we are not going into the details in this session, are incorporated in the child's education plan also. Now, sensory integration therapy, how does it help? Let's see. Sensory integration therapy helps activities of daily living, speech, writing, coloring, copying from board, understanding the environment better. Therefore, it has positive effect on memory, perception, attention, response and learning. यदि बच्चे को सेंसरी इंटीग्रेशन थेरेपी मिलती है, और कौन देगा ये? एक ऐसा ऑक्यूपेशनल थेरेपिस्ट जो सेंसरी इश्यूज के बारे में जानकारी रखता है, और इससे इन जनरल बच्चे की अटेंशन, स्पीच, हर चीज़ों में इम्प्रूवमेंट होता है. सिंस वी आर जस्ट in the whole session we are talking briefly about this, I think इतना काफ़ी है, लेकिन ये थेरेपी अपने आप में एक बहुत वास्ट थेरेपी है. So I think Gauri will move on to, some of the pictures are here for sensory integration, you can see them. There's a wheelbarrow walk. Wheelbarrow walk में क्या होता है कि हम बच्चे को उसके जो हाथ हैं उसके ऊपर रखते हैं और पीछे से उसके पैर उठा लेते हैं, तो वो आगे जब चलता है तो वेट बेयरिंग होता है, एंड इट इज़ वेरी गुड फॉर यूज ऑफ हैंड्स, फॉर फिंगर्स फाइन मोटर्स, वेट बेरिंग हो रहा है, पूरे हाथ पे प्रेशर पड़ रहा है बच्चे के। और इस एक्टिविटी को इंटरेस्टिंग बनाने के लिए अगर बच्चा नहीं करना चाह रहा, वैसे तो अगर उसको सेंसरी इनपुट मिलता है वो ज़रूर करेगा, और अगर हम उसको और इंटरेस्टिंग बनाना चाहते तो हम रीइंफोर्सर बच्चे का आगे रख देते हैं, कोई टॉय, कोई खाने की चीज़, और फिर पीछे से उसको 2 हाथ पे चला के लेके जाते हैं। नीचे आप देख रहे हैं कि एक बच्चा है वो थेरेपी बॉल पे अपनी होल बॉडी की मूवमेंट्स कर रहा है, वहाँ पे भी उसके हाथ आगे हैं, वेट बेयरिंग हो रहा है। बहुत सी एक्टिविटीज होती है, दीज आर जस्ट 2 एग्जांपल्स।
मैम आई वुड लाइक टू आस्क यू मैम, आईक्यू से इन सब चीज़ों का कैसे हम रिलेट करेंगे?
Let me just briefly give an example. Normally, when a child comes with an autism as associated condition, the IQ already the child, when it is having MR, we may label as mild, moderate, severe, this, that, and all. Okay, again, when the IQ, because for identification of autism, IQ is not main focus. But again, the child may come with the behavioral checklist in the course. Again, the mild, moderate, severe will be there. Again, just I'll show you a simple graph. Let us move on to the screen. Association between IQ and adaptive functioning in ASD. This color shows that brown color shows the adaptive functionings and blue color shows IQ scores. Normally, if you take, say for example, a child with average, borderline, mild MR, moderate MR, severe MR, the IQ may show difference, but in the adaptive area, you can't see that much difference. Normally, adaptive behavior usage, it gives an impression, the IQ that normally we call it as unevenness. Because of the sensory overload, there are so many issues. This just now we got up in the Canada University that one of the researchers, he showed research among 192 children. So the IQ may, but then we teachers, we have to think the mild, moderate IQ we label in the MR area. Again, the child is coming with one more labeling as again mild, moderate, this thing, or high functioning, low functioning. There is a confusable words among us. IQ, high functioning, low functioning, is it based on the IQ or what? This and all unwanted questions. But we teachers have to think, okay, now the child is having IQ in the mild, mildly retarded IQ level. Again, his, course score may be severe, or the child may having severe in the IQ as a MR child, but autism associated condition, his course behavior shows is wildly retarded autistic features. That means the child IQ and the autism mild moderate in the rating scale, it may be difference between the combination of it. That means we have to think the child is having IQ as severity, but his autistic feature autistic feature conveys he shows mildly autism features. Okay, now let us move a simple, I will give a gist of what is the teaching strategies. We are generally look about MR child and what we have to think when we are doing with a child with autism and MR. Let us move on to the screen. Instructional methods for children with mental retardation. Principles of teaching: simple to complex, known to unknown, concrete to abstract, whole to part. Stages of learning: acquisition, fluency, maintenance, generalization. This is overall. When we are teaching a child with MR, please always, all teachers or any trainees, they will keep in mind we have to move from simple to complex, known to unknown, because known to unknown in the sense the child familiar object, when we are teaching object identification, it should be a known object. Then move to unknown. If the child has not seen an aeroplane, while we are teaching an object, let us teach glass because daily he is using. This is general. And let us again move on to the screen. When autism comes with associated issue, how we have to think. Tips in teaching: enhance the learning process by tailoring information according to the functioning level of the person. Take time to teach each skill and provide opportunities to practice it in the daily life. Take time to teach essential skills in places and at times when skills are needed. Plan argumentative communication mode in receiving and delivering information. Plan language modality according to the child's level. Identify the type of supports individual will need and do not remove supports when a task is mastered. If a student needs visual cues to learn a task, he or she may always need visual cues associated with the task. Provide students with clear information about the beginning and ending items of an activity and about the expectation of the task. Focus and strengthen on special interest. Plan independent work habits. Structure the environment. A. Physical environment. Placement of the activity, materials, seating, moving boundaries, etc. B. Time. It may be difficult to engage students for prolonged period of time. Be prepared to shift activities and to provide both easy and difficult tasks so that the student will be challenged while experiencing success. C. Activity. Provide visual instruction, visual clarity, visual organization to understand and to perform activities which enhances learning process in a successful way. Provide reinforcement to motivate learning. Plan remedial over problem issues. Now, if you take a child with MR means, as I already conveyed, interactive impact means we have to think. Additive impact doesn't choose because only MR method, as I conveyed, simple to complex, this, that, only if we focus it, we will face problem because the child is having autism also. That means when a child is having this and that together, when we are, I think even Indu ma'am conveyed in the teach method, where, when and how. That means we have to interacting means we are adding and modifying when we are giving an activity to a child with autism. We have to convey what he is doing, how long, showing the schedules, because the child, I think normally one more thing we come across with the problem. Even a child goes to a normal school, definitely he is having timetable. Because he is so called normal, he understands his timetable. When we are wrongly labeling a person as a disabled, how come we are not conveying to the child per day what are the activities he is going to learn? Number one. Number two, we know a child with autism is a visual learner. Some people get confused why I have to show visual this thing. Even I am asking, say for example, as a layman, do you like an advertisement in a radio or a TV? Normally people prefer TV. I am wondering then what is this? Even a so-called normal man, an advertisement comes in a TV gives more knowledge comparing to a radio advertisement. Then what is the problem? We know the person is a visual learner. Then why can't we provide a visual instruction to the child? Visual clarity means, just I will show a small picture of it. See, this is the timetable we are doing with a child MR with autism. What are the activity he has to do, everything. See, visual instruction refers, we are keeping boundaries. What are the object, where he has to take, because if we are keeping object together, the child can't search it. A child with autism always face problem in searching the record. But we keep the boundaries correctly. You have to take and proceed like this. It helps a lot to the child with autism, because say for example I am telling one thing, his child now her age is around 80. We are teaching the thing in the pre-vocational. She is taking beads and doing the bracelet activity. As the bead is falling down, or she is not conveying. As I trained her, she has to convey the bead has fallen down, give me that bead. Or again there is shortage. Because we are writing, give the visual clues, 5 green beads, 2 blue, how many she has to put. Then by just a small slip, the child is doing the activity independently. One problem in the language is if the bead has fallen down, she can't communicate. She will forget about it. Again shortage in this thing means she has to ask the teacher. But till now, I am wondering, she learned to communicate. The problem, she is taking the bead. Literally, I am telling 1, I have written 5 red, 5 green. Okay, 1, 2, as 3 comes, the bead has fallen down. She is calling me, telling, Gauri ma'am, 3 bead de do. She is, see, because when she takes the number what she utters, name of the bead is whatever she utters. I am keep on training for the past 3 months. I am telling, please tell Rashi, tell that bead has fallen down, give me red color bead. She will tell, but what number she added in doing that, she will tell name of that object, that number. But at least the child is learning. We are understanding the child IQ is already problem. Abstract concept for a child with MR also a problem. Number 1. And short-term, long-term memory, one side MR issue means it confuses. Second, autism means what they learned first, it will stick to them. They will stick to it and they will repeat it again. make them to one activity. If I am teaching a child, make the child to do in a different way, it takes more time. When MR comes an associated condition, because it's easy to label a child as a mild or ageable, whatever it is. But if we compare with the rating scales, one of the child, literally I have seen 2 children like that. The child, he is having labeled as a severe child with autism. Okay, he was tied up even up to age 8 in the locked chair in the classroom. He won't do any activity because of the family issue. They are switched over to the other school, other area location. Within 2 years, we received information the child is going to attend 8th standard exam. Listen again, because the labeling, because it's a psychological report, severe whatever it is written. Only thing he is fond of music. The teacher took the nothing. Always Walkman will be there. He will be keep on listening the music. He won't look at the person, whatever. But you ask any question, even with the music, he will answer everything. The parents agreed it. Number one, because of the sensory issue. Second, this all the issue is IQ is 142. Even I am wondering, earlier it was around 40. Now it is 122. Means what is this? He has written the exam, whatever. But again, as I showed in the graph, the adaptive behavior till the problem is there. That problem is already we know clearly autism means unevenness will be there. First we have to prepare, because even forget about high functioning or low functioning, even let him be the genius. But the unevenness, certain area they will excel, and what are the problem area will be there. We can't change it.
Just as ma'am had explained in the very starting of the conference.
Because no, we have to think physical environment, because structuring means because we are making the child to sit with the other children with MR, the child with associated condition. That means how to make the child to sit in a place, how the boundaries, whatever it is. If we won't tell, because one of the child nicely he said, as I asked him to sit in the chair, he was sitting. Okay, again he is getting up. Because don't keep on shouting in the classroom again to sit, because we have to tell how long. Otherwise he is doing correctly from the child point of view, he is sitting. Again he is starting and going, he has not refused to sit. From his point, I used to tell, sit up to the study time. Then he knows break time, everything, because we trained according to the interactive implementation, in the sense what are the autism techniques. We went through ABAT, whatever it is. Okay, we can't do separately this. We linked according to the level of the child. He can understand pictures very well, in the sense. Okay, definitely we started the communication using pics. Otherwise, because ma'am, I am telling, as special educator, when we are teaching pointing the object easy with a child with MR. But autism comes, first we are teaching the imitation activity. Current level is a very important. Do this, that. If the child is not doing, we never tell the child point the object, touch the picture, modifying, because the child, it is a stressful. Because always remember, when a child with multiple disability comes, learning is not an easy process. And again, if you think about autism with MR, means both are troubling in the brain area. Already it is brain dysfunction. Autism is labeled as dysfunction in the brain. That means it takes more time for the child, even as Indu ma'am conveyed the information, auditory information, it takes minimum roughly 30 seconds to process it. But when we are teaching a concept to a child with MR, means pointing immediately, if I am telling touch means spontaneously he will raise the hand. But a child with autism, it takes time, we have to wait. We should not expect, no, the child is pointing immediately, it takes time. You have to wait, but the child takes time, he will point. And one more thing, we have to focus what type of communication we have to, what normally we call learn autism culture. What we speak, because reversal, pronoun reversal is the major problem. We know autism is having I, me, Y. Say for example, a small example I will give, that's all. If a child is eating something, I can't tell taking from others mean don't take, that is her food. Sorry, better tell name of the child. That is Rashi's food, Shiva's food means her name. I won't tell yours food also, because we can't understand, because maximum children are again non-verbal. Whether he has problem in the pronoun reversal or not, we can't understand. Always add the name of the child. It is Shiva's food, this is Rosi's food. When he takes that, we will tell Rosi will eat Rosi's food, Shiva will eat Shiva's food, means the child can understand.
So the teaching strategies for the children with MR and
we have to,
ASD are very
we have to think about the
specific.
communication. We have to add what we are How we use with autism
And like
spectrum.
Gauri ma'am said, we need to remember that a child with autism may be able to operate the computer but cannot point.
Right, yes. So, in today's conversation and today's conference, we firstly discussed what is autism. Autism, an uneven skill profile. It is the hallmark for a person with autism. Then we moved on to the difference between a person with autism and a person with mental retardation. Then we had like 26% of the children with their children who have mental retardation and they have autism as well. This is a study by the UK. Then we moved on to the higher functioning person with ASD, where a person might have normal intelligence or might be more than normal intelligence, but their social abilities are not very much developed. Then we moved on to the different characteristics of a person with MR and ASD. Then we had the different problems that are suffered by children in their learning process. Then we had the impact of multiple disability. More than one disability जब एक बच्चे को होता है तब उस केस में उसे और ज़्यादा परेशानियाँ होती हैं. फिर हमने बात की थी एक कॉग्निटिव डेवलपमेंट क्या रोल प्ले करता है इन बच्चों के लिए. यहाँ हम बात कर रहे हैं एक बच्चा जिसको मेंटल रिटार्डेशन भी है एंड जिसको ऑटिज्म भी है. फिर हमने बात की थी कि कहाँ कहाँ प्रॉब्लम आती है एक बच्चे को समझने में, लर्न करने में, कहाँ कहाँ प्रॉब्लम आती है. उसे प्रॉब्लम आती है एक, क्योंकि वो एक विजुअल लर्नर होता है तो उसका दिमाग अपने आप से नहीं, जो भी देखता है वो सीख लेता है. फिर बहुत जल्दी डिस्ट्रैक्ट हो जाता है. फिर हमने देखा था बहुत इम्पल्सिव होता है वो बच्चा एंड इंगेज करने में बहुत प्रॉब्लम होती है उसको. फिर हमने देखा था उसका मैनेजमेंट प्रोसीजर, जिसमें वी हैड सीन अबाउट द एजुकेशन इंटरवेंशन, देन वी हैड द बिहेवियर इंटरवेंशन, कम्युनिकेशन इंटरवेंशन, sensory intervention, then medical, vitamin and the dietary intervention. Lastly, we moved on to the popular strategies, that is the applied behavior analysis, जिसमें हमने देखा था कि कैसे एक बच्चे का बिहेवियर हम मॉडिफाई करते हैं अपने बिहेवियर से. उसके लिए हम डिजायरेबल बिहेवियर करेंगे तो वो भी हमारे लिए जो हम रिस्पॉन्स चाहते हैं वो करेगा. फिर वी टॉक्ड अबाउट द टीच स्ट्रैटेजी, जिसमें हमने देखा था कि कैसे एनवायरनमेंट को हमें मॉडिफाई करना है. फिर वी टॉक्ड अबाउट द सेंसरी इंटीग्रेशन थेरेपी, जिसमें कि क्योंकि एक बच्चे का हम कोई भी काम करते हैं उसमें हमें बहुत सारे सेंसेस इन्वॉल्व होते हैं एंड इन बच्चों में थोड़ी प्रॉब्लम होती है अपने सेंसेस को कोऑर्डिनेट करने में, अपने सेंसेस को एक तरफ ऑर्गेनाइज करने में. तो कैसे इनकी थेरेपी दी जाती है उसके बारे में हमने बात किया था. लेटर वी मूव्ड ऑन टू द इंस्ट्रक्शनल मेथड्स फॉर द चिल्ड्रन MR, जिसमें हमने उनकी प्रिंसिपल्स कैसे हम फॉलो करना है कि सिंपल टू कॉम्प्लेक्स आए, कॉन्क्रीट टू एब्स्ट्रैक्ट आए, नोन टू अननोन आए एंड देन होल टू पार्ट आए. फिर स्टेजेस ऑफ लर्निंग के बाद हम बात करी थी डिफरेंट टिप्स दैट द स्पेशल एजुकेटर्स नीड टू कीप इन माइंड. We'd like to thank our experts for taking out the valuable time and precious knowledge sharing with us. That is all for today's conversation and conference. I hope you liked our show. Thank you for watching us.